KFUG Community Radio. Time now for Health Matters. And I was just laughing because Lynn has a cough drop. And then right before I started
timing.
talking, all I could hear was
Crunch, crunch, crunch.
But I think that lends itself perfectly to the show. I mean, it's Health Matters. So Lynn doesn't want to cough into the microphone. Lynn Szabo, PA. Hi, I'm Paul Kritz. This week's Health Matters is kind of interesting. I've been... if you don't know what KFUG does, the station from which this show emanates, we have we do the news here in Delaware County. And one thing recently that I have been striving to make connections so that we could highlight on in some sort of fashion with the news, and this is something I haven't assigned this to anybody, just something I've started looking into, was how to take all this craziness that we see in the news happening in Washington and make it real for us, like boots on the ground, butts in these chairs here in Del Norte.
Right.
And so the first thing is, I'm trying to find somebody. There's been like a fifth of our local Park Service employees, federal employees who have been fired. And so I'm trying to find those people to tell their stories and to highlight. This is what all of these big abstract conversations, how it will play out in our lives right here in our community. And it's just beginning. Another aspect of that is what you wanted to focus on in today's show.
How health is being affected.
And like things like websites and resources that you ordinarily check disappearing and going away, everything being quote unquote paused, and what that means, because that is another way that these big sort of meta things that are happening to American democracy in general are going to play out right here on the ground in Delaware County. So let's dive in. What's your experience been the last month or more?
So I looked at this actually as three different areas. The first thing that happened to me personally is that I couldn't find the flu map for a couple of days. And we are having like the flu season that won't quit. It's not like a biphasic one. It's like...
It's just been going all the way through, right? Yeah,
it's just plowing through. So it's still bad. So the flu map did show up, and it was recent.
And what sort of information would you glean from the flu map?
What's circulating in a community, relatively speaking, and what I should be considering.
What strains of flu are circulating? That's specific?
Whether, like, what's the predominant virus in the community? So right now it's influenza A. But also, is there RSV? Is there, know, so I don't only look at the flu map, but it disappeared for a while, and I had a moment. I really did.
I bet.
But there's other things that affect providers in their ability to take care of a rural population. And the first one that I kind of looked at is the food recalls. This is important to me because I take care of pregnant women, and food recalls are a big thing. Especially, spinach that's contaminated with listeria, for example. Also take care of elders, don't want them to be eating metal shavings.
That's what I said. There's mac and cheese bites with metal shavings in it is one of the listings. So how would you ordinarily get information about food recalls like this?
So I would go to the Center for Disease Control and look it up. And I have to say, I put three, types of food kind of vaguely described as an example of what we're looking at. So mac and cheese bites with metal shavings, dried plums with undeclared sulfides, which is an allergy risk, and pet food made with chicken meat that had had avian flu.
Wow.
So it's possible to bring the avian flu into like the cat population.
Really? Just after
with cat food,
even going through processing and everything like that?
And that would make it a reservoir.
Wow. Okay.
So that would make it harder to get rid of. So that's a huge big deal. Obviously big safety issue, but out of the examples I found, I could only find information at the FDA site for one of them.
Wow.
And I don't know if that information is accurate or represents a delay in information. The concern is that the man who heads the FDA, and he's been a long-time leader in the FDA, and especially food safety, his name's Jim Jones, actually. He resigned, presumably under pressure, because he'd been there for a long time.
He would have been one of the people that would have come under fire.
Yeah, so he resigned on 2/18/25, and the medical community is aware of that. That's a huge, big thing because he's primarily responsible for food safety oversight.
Wow.
So,
And you kind of hinted just a second ago at another follow-along problem I don't think is readily visible on the surface, and that
Yeah.
is what information you do find, you have serious reservations about now.
right. And so now we have to double check our sources. And before that, the CDC was the go-to place for good, reliable medical information.
Oh, wow.
So the workaround here is the Canadian Food Inspection Agency, which may have more reliable information. Go Canada.
Right on.
And so which Del Norters is this going to impact the most? Well, kids with peanut allergies or groundnut allergies, big deal. Pregnant women or pregnant people like I mentioned before. And the general public who doesn't want to eat bits of foreign material, in their food. I feel like I want to watch this one for a while because I felt like online it said, look at these specific brands and these specific products. And I went to the CDC site and I could only find 1 out of 4 of them. There were actually 4.
Wow.
And then I went to the Canadian site and immediately I found one of them. And it was a pancake mix that had dairy and wheat in it. And so it was pretty easy to find on the Canadian side. It was findable on the CDC or the FDA site, but it wasn't easy to find.
Wow.
Yeah, I think the Canadian site is more user-friendly, actually. But I want to watch this because it's not clear to me if they're really not putting up the information. I think they are. I think it's just a slow walk to get the information.
Is that new? That slow walk, or is it just a
It
poorly
is
designed government
implied
website?
in the medical community is suspected that it's new.
Wow. Okay.
But I don't know one way or the other,
Well,
really.
anybody who's interacted with a government agency website can understand just how easy it is to get lost in these
Right.
Byzantine palaces.
Right,
Yeah.
but when you're interacting with the CDC website, for example, as a medical professional, you understand how to get around it, okay? Because you're doing it multiple times a day,
Right.
to get up-to-date information. And it just looks different. I don't know how to tell you.
Wow.
There's a lot of times you can click on a hyperlink and get up to, we couldn't find that page, or
Right,
that
right.
page has been taken down.
Yeah.
And that worries me.
Huh.
So the next thing, and especially the CDC, has been purging mostly guidelines on contraceptives, STI prevention, HIV testing, tuberculosis, and vaccines. Also, intimate partner violence. That's
What's
what
that?
IPV is.
IPV, what is that?
It's intimate partner violence. So I looked at it at first and thought, what, injectable
Yeah.
polio vaccine?
Well,
What's
yeah,
that?
yeah.
Why is that in here? But no, it's domestic violence.
Okay, yeah, just right.
Okay, it's what they call domestic violence.
Why
And
those things?
those are important things to
But
people's lives. In
Contraceptives, SDI, HIV testing,
right.
TB, and vaccine. What the? Okay.
So tuberculosis. Oh my God. So where can you go to find this information? So yay, medical
Canada?
people stepping up.
Oh.
American College of OBGYN, the most conservative medical entity, I think, maybe in the top 3 in the entire United
Really?
States, has taken these web pages. I think they had a little heads up they were going down. And they snatched them and put them on their website.
Wow.
So that's a place to get the information that no longer exists where it should be. And also thanks again to the Canadian Health Service, Canada. It's known as Health Canada. And the online presence is the Public Health Agency of Canada.
Okay.
And their site, again, way more user-friendly and has a lot of great information, kind of sneaking in there also support for universal health care.
Oh, wow, really?
I'm like, go team. Yeah. So, this is important because, for example, gonorrhea up here in Del Norte is changing, and probably worldwide, is changing its resistance profile so that what we used to treat it with is not what you should treat it with now.
Oh, wow.
And it's important to, and it's also around more, probably because people are being incompletely treated. And so when you have somebody that's got this disease problem, you don't want to guess on what it's going to get them better.
Yeah, yeah.
You want the most accurate available information. And to not go to the sites that we're used to going to and getting that information is really frustrating.
Wow, wow.
So if you, as an individual, maybe with health concerns, need to get this kind of information, go to Canada, go north, or go to the American College of OBGYN.
Man.
Yeah. And then the other thing that healthcare providers are missing with important guidance is, and this one's really important, is new drugs. Mm-hmm. This could be capitalistic. Why do they have to disappear? Why are we not getting the information we need? For example, there's a new drug called Symbravo, which is a new way to treat migraines. Uh-huh. And my understanding is it's not just a reformulation of previous medications, that it's totally a new way of looking at it.
Wow, okay.
And migraines are debilitating for a lot of people. So we should have that information hot off the press, as far as I'm concerned. But I couldn't really find it. I did finally find it in my Hippocrates. So
now this was, I was going to ask, and you answer in the very end. Ordinarily, you would find information about new drugs on the FDA and CDC
They
sites?
would send us emails.
Wow, okay.
They kind of blanket us with emails constantly. That's also stopped. Or not stopped, but really slowed down. And then the other new drug is for pain control, and is supposed to be really effective non-opioid. And so when providers are treating somebody with a chronic pain issue, we have the usual anti-inflammatories and Tylenol, or acetaminophen if you want to go with, a generic name. And then we have opioids. And patients are usually shocked that there's nothing in between.
Wow, okay, yeah. That was a little surprising to me when you lay out, here's the stuff you can buy, and then here's the stuff you can't, and then there's nothing in between. But yeah.
There's nothing in between. And opioids are really hard to get right now. So what if somebody has really tried ibuprofen and acetaminophen, and they just find them lacking? Well, the way of looking at it right now is to give somebody like a bunch of different tools, and most of them are on the patient to acquire. So like ice or rest or physical therapy. The patient has to go and do something, and oftentimes it's not as easy as a prescription anymore. But this is a medication that I couldn't find any reference to it. And it's almost like it's hypothetical right now. We should have, if this is a real thing, we should have information on it.
So you don't even know if it's a real thing?
I think it's a real thing. I do believe it's a real thing because providers are talking about it, but nobody knows anything except, is this a real thing? We know about it, we're talking about it, but we don't have any details.
How do you know? How do you know about it? Just hearsay?
Yeah.
Huh.
From anesthesiologists and pain control specialists.
Okay.
Yeah. So it's not like it's written on the bathroom wall.
Right.
It's coming from what could be credible sources, and this could be an important tool, and there shouldn't be any misinformation or delay about it.
In the past, you would have gotten an email about this? You would have been notified about something if it were already being used by these specialists?
Yeah. Okay. And I haven't even gotten advertising about it, which is a little weird because this is a capitalistic moment, and medicine loves that. But, I don't know if did a bunch of people get laid off and nobody can talk about it because nobody's sitting at the desk doing the work. This is an example of stuff that's getting overlooked, in my opinion.
Wow.
Yeah. So, the other part of information that's important to us, and we get notified pretty much weekly, there are 3 growing epidemics in the U.S. presently. An epidemic is the correct word. There's a measles epidemic in Texas.
Wow.
And did you personally know that?
I just saw something about 60 kids in Texas. It came up in a news feed, honestly, within the last 2 days.
Yeah. So I've known about it for about a month. And I know that it's also kind of jumped the border into New Mexico. And I know that children have died. And I know it's almost 100% in unimmunized individuals. And I know some people have been hospitalized because measles is not a trivial disease.
No, we forget, I think, culturally what measles, how bad
Well,
measles
remember
was.
when we used to use it as like a weapon of war on the Native American community?
Well, no, I don't remember that.
Oh,
no,
I don't
but
remember
yeah,
it either,
exactly.
but
yeah.
I learned about it in school.
Well, yeah, sure, but growing up, that was like ancient history, and measles
Right.
were a thing of the past.
Right.
Wow.
Well, it's back. Okay.
And it's mostly unvaccinated kids who are dying because
Almost
of this.
100%.
And of course that isn't going to make the national media. That I assume that
Right.
isn't making the national media. That's being kind of hushed up then, because that's the kind of thing that would shut RFK Jr. up. Right in his
Right.
face, or like, he's probably thinking, "Oh, they're eating wrong" or something stupid.
Exactly.
Jesus.
There's also a TB epidemic in Kansas, and I think it's crossed over. I don't know if it's crossed over into Ohio or if Ohio has its own thing going
Well,
on.
I hope something else is happening, because Kansas and Ohio are nowhere near each other.
Well, by air, they could be.
Yeah, okay.
Yeah, think about somebody coughing on a plane with TB.
Okay, all
and
right.
they're flying down.
It's the crossing over into Ohio. Just jump
Right.
into Ohio.
And
Okay, that's all.
tuberculosis is not always a disease that, it's not like strep throat. You get exposed, a couple days later you got symptoms. And the medical community knows how to deal with it and get rid of it. It's indolent.
Right,
know?
right. But isn't TB kind of always lingering around on the margins, waiting to become a problem?
Right, there's latent TB, and that's what you're talking about, I think. But there's also
I just mean culturally, just the numbers wise. Like
oh yeah, it's a worldwide killer.
Yeah,
and
yeah.
historically has been a worldwide killer. And yet, and the medicines you go on are not, like really kind to your body.
Yeah,
They're
yeah.
difficult to take medications, and you have to be on them for months. And then there's always the specter of multi-drug resistant tuberculosis, where anything we have to treat it with doesn't work.
And Trump has said he wants to go back to the Gilded Age, right? And that's, when we had the huge
yeah.
sanatoriums filled with TB patients. So, hey,
And
there
a
you
lot
go.
of local Native American people remember being there as children because their parents got forcefully relocated to those. So there's a lot of local elders right now who have tuberculosis previously treated or a history of latent tuberculosis. So it's real. We have these people in our community. This affected their lives. It's horrible. And we're not hearing about it. We should be hearing about it.
Any idea about numbers with the TB?
No,
Okay.
I do know that they kind of qualified it and said it was epidemic in Kansas. I think they referenced a number 90, but that's kind of wobbly. And in Ohio, it's not really at epidemic levels. It's just super common. And so if I was a provider working in Ohio, I would want to know when it goes from super common to epidemic. And is that going on in Cleveland or is that going on in Cincinnati? Stuff like that. That's the kind of information that we should be getting from the CDC, and we're not.
Right.
And then, of course, everybody's favorite avian flu, which is more widespread and not being really either tested for or reported on. There's used to be kind of like, well, you have to have association like in the dairy industry or the poultry industry. They're starting to see avian flu right now in people with backyard flocks, which is both you and me. And, I want to know what the numbers are. I want
Yeah.
to know what the risk is. I want to know how I keep my flock safe, but most importantly, how I keep my cat and my person safe. And it's what seems to be happening if you look at the, the food safety stuff is really, sacrificed flocks. Are they really becoming dog food and cat food?
Right, right.
Because that could be an economic move that somebody would think of, but it's a really bad epidemiologic move.
Yeah, yeah.
Yeah, really bad. And some people are dying from avian flu. But, if you don't look, then the disease isn't there, right? Yeah, we're both eye rolling. There you go.
Yeah, that doesn't come across on the radio so much. But
Yeah, and how about that high price of eggs, right? This is the real reason that eggs are expensive. Yeah. So, and then what happens when eggs get expensive? More people seek out backyard flocks.
Exactly. That's
Yeah.
what. Yeah.
So there's a couple helpful tools that I thought were hilarious. Do you know about this first one?
I do, because I am a supporter of the Internet Archive, and
Are you
and this is a
really?
subset of the Internet
It
Archive.
is.
Yeah, yeah.
The
and-
Wayback Machine. Do you know where that comes from?
Yeah.
The word, the name?
Yeah, yeah. I
Yeah.
remember. I grew up watching Bullwinkle. I remember
It,
that.
it wasn't Bullwinkle.
Yeah, it
It was
was.
Sherman and Peabody.
It wasn't his own show. It was a part of the Bullwinkle show.
Yeah, okay. All right. I didn't get to watch too much TV. But the Wayback Machine.
I was encouraged as a child to watch Bullwinkle. That's I've got family like that. So
Well,
yeah.
my source, which is Wikipedia for this,
Mm-hmm.
is that the name comes from Peabody's Improbable History,
Yeah.
which must have been a subset of it.
The Wayback Machine was a time traveling machine, and they go back in time and incur. He and I forget the kid's name. I can still see him. It was Mr. Peabody, Sherman.
Sherman,
They
yeah.
would go back to just little vignettes.
And Mr. Peabody is a dog.
The dog with
right?
the glasses.
It
yeah.
looks like a professor
Yeah,
kind of dog. Anyway, I thought that was hysterical. But it's a San Francisco nonprofit that tries to store what websites look like in the past.
Uh-huh.
So it's kind of like a huge, big electronic library dating from, I think, what is it, the mid-'70s?
Yeah, I have no idea how
Something
far
like
back it
that.
goes. I do use Internet Archive for a lot of things and
Right.
give money to them too because
Right.
of what they do. They were almost killed. Copyright stuff almost killed them this last year, and they had to fight legally for their lives. And the Wayback Machine is a subset, is a thing they offer. I also know that when our KFUG radio website went down for some hacking reason or whatever, and we were having the new site built, that the developer who was building our new site wanted to look at the old site. I'm going, well, it's been down for months. I don't know what. He went to the Wayback Machine, and they had a snapshot of the old pages on our site. So they just kind of pass through sections of the internet and back things up visually so that
Right.
people can go back and see them later.
So maybe you can answer how the two relate to each other. I get the Wayback as a subset of the Internet Archive, but I think the Internet Archive is what takes the information in and then they store it in the Wayback Machine.
Yeah, that's how
Is
I
that
understand
kinda
it to be.
Like the archive opens the door, but when you go through, what you see is the Wayback.
Yes,
Kind
yeah.
of, for
Like,
those of us who are not super nerdy.
when you log on to the Internet Archive, or just open it up in a browser and see the Internet Archive, the very first search bar is specifically for the Wayback Machine. But people use content creators use the Internet Archive to share media and segments. There are shows that you can get from the Internet Archive and download and play. And I used to do that before we moved to other things. And then also just backing things up. There's a fella that I've been interviewing, and he's given us the rights to an album that he put together back in the 70s of classic American folk music.
Oh, lovely.
And because he has the rights to it, and he's just an elderly guy now. And he said, and I've been interviewing him, and he goes, "Yeah, you guys have a record label. If you wanted to put this out, you could. I have the rights. We'll put it in writing and do all that." The only place I could find a copy of this album, because it was so rare, was on the Internet Archive. So I downloaded it from the archive, and we've got those files, and hopefully we'll put it out in some fashion someday. But it's a very valuable website to just go dink around and look at and support. I try to give them like $100 a year, just because I use it and it means something. This is something that people have tried to get rid of. That tells you how important it is.
So that's where the CDC information that's disappeared has gone to roost. So if you want to look at CDC information, if you're looking at more like women's health, the American College of OBGYN, if you're looking for something, like what's going on with TB in Ohio, Wayback Machine.
Now, can you find current stuff there? Or will the information in the Wayback Machine sort of remain static in age as time goes on?
Yeah, I'm told you can.
Wow,
But you
okay.
know more about it than I do.
No, I
so-
never used the Wayback Machine.
Oh,
That's
okay.
why. So
Oh
I've
no,
never
they're
done-
sending everybody. Everybody's talking about the Wayback Machine.
Great.
Yeah. So yeah, hopefully their donations will pile up.
I know they're leaning into it. I did see something. I think I got an email, some spammy email from Internet Archive about, hey, the Wayback Machine is saving government sites. I saw that. So it's not just the health sites, but other government sites that are going
Right.
away or have been quote unquote paused.
The other thing I didn't really write in the notes, but the weekly publication, the Morbidity and Mortality Report, disappeared for a while, and medical people were like horrified because we rely on that.
That's a way for you guys to share information. And
Right.
yeah, wow.
Right.
Oh my God.
Yeah, it was especially important in the COVID years, but
Mm-hmm.
it has come back, but it is watered down.
Mm.
So it's definitely, the feeling is that it's definitely censored.
How's it been changed?
Well, first of all, it's not as long. It doesn't have as much
Not as
information.
much detail or anything?
Yeah.
How do you feel like it's been censored?
It's not talking about what it ordinarily it would be talking about.
Mm-hmm.
Like it would be talking about avian flu. Yeah, not much. Scientifically, it's just thin now. So that's another thing that is kind of horrific to healthcare providers. So this is going to impact how care goes to people, not only in Del Norte, but also in California, Northern California, Southern Oregon. This is a huge, big deal. And, there's some providers that never really rely on updated, but I'm kind of, in the people I work with are kind of obsessed. I mean, we talk about these reports like people talk about the football game on Sunday.
Right.
Did you see it? Did you read? Or when you want to one-up each other. Well, I read this week in the MMWR that,
Who won the CDC poll?
yeah, stuff like that. And I feel the absence of information, and that puts me in the guess zone, and I don't like that.
Right.
That's not responsible as a healthcare provider. You can have intuitive feelings and stuff like that, but you can't guess. You really can't guess.
The circumstances, the situations, the conditions that you're faced with, those change every minute on the ground all around us.
Right.
Your information should be able to keep up with that.
It should be cutting edge, and right now it's been dumbed down and kind of disappeared.
Can you
watered down?
glean from what's missing if there is any sort of overarching...
There's two of them.
What?
Sorry.
No, finish my question.
Overarching
What?
theme.
Overarching what? No, I'm trying to figure out...
Focus.
I'm trying to figure out if you can glean some sort of reasoning, like, what are they cutting out and why are they cutting out?
Well, they're cutting out women's health.
Right. And why?
Especially because they want women to be pregnant.
But isn't that a matter of women's health too? That's what I don't get.
Right. So I feel like it's definitely decreased the ability to give good, comprehensive women's health care.
Wow.
And it's also a little capitalistic. Like, you guys don't want to know that, the spinach is
Right, or that the
contaminated.
chicken's bad.
Yeah,
or
if I don't
yeah.
say anything, that
Who's
means
you're not
it's
gonna stop
la, la,
buying.
la, la, la. Yeah. So capitalism and women's rights are I think, two of the big motivators.
Right. My
Yeah,
God.
It's
my
horrific. As a woman's health care, especially reproductive, person taking care of pregnant people and also taking care of people who need hormonal contraception, for example, teenagers in this community. This should,
Especially in this community.
I
yeah.
have to have these resources to bring them good care.
Yeah. Yeah.
And so I guess I go to the Wayback Machine, or ACOG, which is the American College of Obstetrician and Gynecologists.
Or maybe you can be, you get like sort of board certified for Canada or something and
Yeah, go
can
Canada.
log in. Oh, wow.
Right.
Is there, looking forward, is there a way, we've got 1 minute left, and this perhaps is not a question, maybe just pose the question. Is there a way for California to pick up for the state of California to pick up the slack on some of these things?
Oh, I think it's probably happening.
That's what's going, that's the most
Oh, yeah.
efficient way to deal with this
Yeah.
then. Because I imagine there's, public health in California is very well developed and into
Right.
everywhere.
And we also have great support for reproductive health. So, and the whole West Coast is a bastion for reproductive rights and
Right.
choice.
Wow. All right. Well, Lynn, I guess thanks. That was a drag, but all the political stuff is these days, it seems, especially when it comes to healthcare and the continued politicization of healthcare. Of every, I mean, to
Right.
take it, not just to take the continued politicization, whatever, to take that. Oh my God. Yeah. Okay. That's all I got. I'm aghast.
Yeah.
So next week,
Yeah, I'm wondering if I should do an update on avian flu.
I think maybe that would be
I
good.
think I have to be the voice in the wilderness.
All right. Well, we'll look forward to that then. Thank you, Lynn.
Okay, thanks.